with your help, we will stop at nothing. This is Human Care.
It's being billed as a $1 billion movement. Launched this past week, Human Care from Toronto's St. Michael's Foundation is an ambitious campaign to reinvent how patients experience the healthcare system in Canada. According to a recent Leger survey commissioned by the foundation, the majority of Canadians feel the healthcare system needs an overhaul. The experience is worse for marginalized Canadians. Close to two-thirds of those living with disabilities and those within the BIPOC and LGBTQ communities say they don't feel safe, respected, or listened to when receiving care.
What's behind it? Why are they disproportionately saying these things?
We know from other research, and I know from my own experiences working with patients on the internal medicine ward at St. Michael's, when you're sick, you feel pretty vulnerable. And there's a huge power imbalance between the healthcare professional and the patient. And that power imbalance is magnified even more for people who are new to Canada, for example, or people who are transgender, or people who are Indigenous. The fact is that Indigenous people, Black people, newcomers to Canada, they face racism in the healthcare system every day. And that's what we found in the survey.
The Human Care campaign aims to address these concerns by lessening wait times and dismantling barriers. Dr. Dallas says part of the strategy will involve new types of training for healthcare professionals, training using advanced technology like virtual reality.
And through these virtual reality simulations, you can actually get a sense of what it would be like in a system where you don't speak the language that the healthcare professionals speak. And so you can imagine that that's a really powerful experience for a learner.
The foundation also aims to build what it calls a Care Experience Institute, focusing on research, education, and programs. How AI and advanced analytics, for example, can help lighten the load and allow healthcare professionals to dedicate more time to their patients.
It's going to take time. That's why this isn't a 6-month campaign. This is a campaign that'll probably take a decade. But the hope is that a decade from now, everyone who walks through our doors, everyone who walks through the doors of any healthcare organization in Canada feels comforted, feels connected, and feels confident.
For CityNews, I'm Natividad.